Welcome to Blue Glass channel. I am a medical lab expert who is working in hospital and academic lab assistant. Today I'm going to talk about what is the meaning of elevated WBC in lab results. Your lab results came back and you see your WBC count is elevated. What does it mean? Today I'm going to talk about the function of WBC in our body and what kinds of the criteria are going to be important and mostly going to be considered and checked by your physician and healthcare provider to understand is this kinds of elevation in your white blood cell count is important or not. So let's begin.
What is WBC? First, let's talk about what WBC actually means. WBC stands for white blood cell count. White blood cells are an important part of your immune system. Think of them as your body's security team. Their job is to detect threats, fight infections, and help protect you from harmful invaders such as bacteria, viruses, and other pathogens. When your body senses a problem, it may produce more white blood cells to respond. Reason number 1. Why does WBC increase? The most common reason for an elevated WBC count is infection. When bacteria or viruses enter your body, your immune system responds by producing more WBCs. This is completely normal and often a sign that your body is doing exactly what it is supposed to do. Number 2, inflammation. Infections aren't the only cause. Inflammation can also increase white blood cell levels. Conditions involving chronic inflammation may lead to higher WBC counts because the immune system remains active. Physical and emotional stress. Many people are surprised to learn that stress can affect blood test results. Physical stress, intense exercise, surgery, injury, or even severe emotional stress can sometimes cause temporary increases in white blood cell counts. Number 4, smoking. Smoking is another factor that may contribute to elevated WBC levels. Studies have shown that smokers often have higher white blood cell counts compared to non-smokers. Reason 5. Certain medication. Some medications can also affect white blood cell counts. That's why doctors often ask about medications when reviewing lab results and lab values. This is one of the most common questions people ask. Does high WBC mean cancer? The short answer is no. A high WBC count does not automatically mean cancer. While some serious medical conditions can affect white blood cell levels, most elevated WBC results are caused by much more common reasons such as infections, inflammation, or temporary stress. This is why doctors never rely on a single lab value to make a diagnosis. When doctors evaluate a high WBC count, they do not look at a number alone. They consider your symptoms, your medical history, other blood test results, and sometimes the specific types of white blood cells that are elevated. A complete picture is always more important than a single number. If your white blood count is abnormal, the best step is to discuss the result with your healthcare provider. Only a qualified medical professional can interpret lab findings in the context of your overall health. Remember, a lab result is a clue. It is not a diagnosis by itself. So, as a recap, White blood cells are part of your immune system. A high white BC count can be caused by infections, inflammation, stress, smoking, or certain medications. Most importantly, a high white BC count alone does not tell the whole story. Doctors always interpret lab results together with symptoms and other medical information.
So if you found this video helpful, please give it a like and subscribe for more videos in the world of lab results. And if you have any further question or you have a suggestion about what kinds of the lab results would you like to be explained here, please write it in comments. I will read them and answer them, and I will prepare as soon as possible a new video based on your suggestion. I'll see you in the next video.